Pathogenesis and laboratory diagnosis of syphilis. Treponema pallidum is a causative organism of syphilis. Syphilis is acquired by venereal, non-venereal route or congenital. Venereal syphilis is caused by it's a sexually transmitted disease. Spirochete enters the minute abrasions on the genitals. So, infective dose is 60 treponemes. After entry, multiplication of treponema happens at the site of entry. Incubation period is 10 to 19 days. What is incubation period? Entry of organism and development of clinical signs and symptoms. Longest incubation period you see in rabies, and from the entry and spread to the lymph nodes, there is a rubbery lymph nodes. Ulcer is plainless, and classification include primary syphilis, secondary syphilis, tertiary syphilis. Late tertiary syphilis or quaternary syphilis, neurological manifestations such as Babes dorsalis and general paralysis of insane dilemmas. Non-venereal syphilis, when doctors touches without wearing gloves, can get in the fingers. Syphilis can occur. All the blood should be screened. So what are the transmitted diseases? TTDs: hepatitis B, hepatitis C, HIV, cytomegalovirus, syphilis, malaria. All of the blood or the donations should be screened for all these infections. Sometimes it occurs post blood transfusion. Congenital syphilis transmission occurs to mother to child in intrauterine life. Congenital syphilis develops after 4 months of gestation. Lab diagnosis. So from the clinical lesions, the painless ulcer, you have to take the exudate from the clinical lesion, serum for the serological test, and CSF for the neurosyphilis. Okay. So uh, microscopy. Wet film preparers are prepared from the exudate, viewed under the dark ground microscope. Treponema pallidum exhibits slow movement, appears slender, spiral structure. Dark ground microscope is used. Direct fluorescent antibody, you tag the antibody with fluorescent dye and put it onto uh, the smear. It fluoresces under ultraviolet microscope. In Fontana's silver impregnation with leviditis methods are used for the staining in the tissues. Serological test, reagent test of antibodies. Cardiolipin less than cholesterol is used. There are 3 standard tests for syphilis. VDRL. Long form of VDRL is venereal disease research laboratory test. Cardiolipin less than cholesterol as the antigen, and cardiolipin is lipid extract of beef fat less than cholesterol, and standard for syphilis are VDRL, Khan's, and Wassermann's. Wassermann is complement fixation test. Khan's test is tube flocculation test. VDRL is light flocculation test. So RPR, rapid plasma reagent test. Its modification. It's quick and fast. Here the antigen is coated onto the carbon particles. Now response can be detected by RPR, VDRL, and Khan's test, Wassermann test. Specific treponemin cells, there is a non-pathogenic treponema cultivable media, that is Ritter strain. Treponema pallidum medical strain maintained in the immune suppressed rabbit's testis. That is a pathogenic strains of Treponema pallidum. The Treponema pallidum immunization TPI, it's a gold standard test for diagnosis of syphilis. Fluorescent treponema antibody test, indirect fluorescent antibody test, PPHA. Treponema, the antigen is coated into RBCs and look for the agglutination. Enzyme immunoassay is also employed for rapid agglutination for the detection of syphilis. And TPH and fluorescent treponema antibodies test are excluding false positive reaction, biological false positive reaction. Congenital syphilis diagnosis is done by early detection of IgA antibody in fetal serum. That confirms the diagnosis. Please remember, it's very important, most often asked 5 marks question. pathogenesis and label diagnosis of